Professor Klein here, and I want to do a video on the larynx model that does open up so you can see inside. Let's begin. Let me start by giving you a 360 of the larynx model, and this is basically the throat or the voice box area, and you can see a lot of cartilage, one bone, ligaments, the thyroid gland, and a lot of muscle that we'll go through as well. But if you're thinking, where are we at in the body? If I come over to this model and we can see the mouth up here and the nose, come down to right about here. So here to here, where the probe is, that's what we're looking at with the larynx. And we'll kind of bounce back and forth, but the first one to look at is this bone right here, the hyoid bone. Now if I come back here, this is the hyoid bone. And the hyoid bone kind of looks like it has some horns, and these are called lesser horns and greater horns back here with the body in the middle. Now something special about the hyoid bone is it does not articulate with any other bones. So it's floating in a sense, not forming any other joints, but there's a bunch of ligaments and muscles that hold it in place. Now as we come down, the next major structure to look at is the thyroid cartilage. Thyroid cartilage goes all the way around to about here, and then the other side it does go the same length, but it's covered by some muscle. Well, the thyroid cartilage is made out of hyaline cartilage. That's the specific type. In fact, everything on this model that I'm going to mention about cartilage, all this blue stuff here, is hyaline cartilage, except this flappy structure, which would be the epiglottis, and that's elastic. But back to the thyroid cartilage. You're going to see a bump on the front, and this bump is referred to as the Adam's apple. Well, more specifically, it's a laryngeal prominence. And everybody's got one as it sticks out a little bit to the front. Now men, it's a little bit more pronounced or larger due to testosterone than women. Keep coming down, and we've got the cricoid cartilage. Again, hyaline cartilage is a specific type, but it's called the cricoid cartilage, and it would wrap around this other side as well. Keep going, and now we're in the trachea. These blue rings are called tracheal rings, and they are C-shaped as they do not go all the way around. They stop right about here on each side. Okay, well, what's in between? This ligament, which can also be called a membrane, is called the thyrohyoid ligament. If I swing that around, that's a pretty big ligament. So we also call it a membrane for that reason. But it's named after the two structures that it connects. And notice how their fibers are running vertically. That's the collagen or collagen fibers that make up a ligament in dense, regular connective tissue. Well, if you have a thyrohyoid ligament, you also have a thyrohyoid muscle, which is seen right here. Coming down, similar pattern. And here, we've got the cricothyroid ligament or membrane and the cricothyroid muscle, going from the cricoid cartilage up to the thyroid cartilage. How about this gland? This is the thyroid gland, but you can only see about half of it. So imagine another half on this side. That's going to deal with hormones and helping with metabolism mainly. If I keep going, you can see an artery and a nerve right here as well. But let me flip it around to the back and see some structures. Here's the epiglottis. And as a reminder, the epiglottis, and if I bring in this larger model, it is a flappy structure that covers the trachea when food or drink goes down the esophagus. And if I bring in another model, here's a picture not a picture, a model of the epiglottis that would close, and then food would go down the esophagus versus the trachea. These muscles back here also have specific names. For example, this is the inferior pharyngeal constrictor muscle. You can see it on either side, and imagine it wrapping around so it would connect where the probe connects, but the esophagus would be in here as well. Deeper in here, posterior cricoarytenoid muscle. Transverse, just these fibers here, transverse arytenoid muscle, and then see the X, or at least half of the X, that would be the oblique arytenoid muscle. Can't see it on this model, but up here would be the arytenoid cartilage and the corniculate cartilage, which would help move the vocal cords. And let's pop this open so we can see those vocal cords. Now if I come down here, this is a sagittal view, you can still see the hyoid, some fat in here, thyrohyoid ligament, thyroid cartilage, cricocartilage. This would be the cricothyroid membrane. And then the tracheal rings down here with the tracheal ligaments in between. I did forget to mention one ligament before. This is the cricotracheal ligament right here. It's in between the cricoid cartilage and the trachea. So a special name for this little area right here, this ligament is called the cricotracheal, whereas this and below would just be tracheal rings. Let me show it on this model. As you can see, the cricotracheal ligament in between the cricoid cartilage and the trachea, and then the tracheal membranes or ligaments as follows down there. But back to these folds in here, we can see the bottom one is the true fold, which is also called the vocal fold, which can also be called the vocal cord. So lots of names for this right here. Up here is the false fold or the vestibular fold. Fold and cord you can use synonymously. Now what those are really continuations of the membranes from the cartilages themselves, either the thyroid or the cricoid, kind of coming up and forming together. So they would form something that sort of looks like this, where you have the vestibular and then vocal, but vocal are deeper. Vocal are deeper. What else can you see here? A little bit of muscle, a little bit of muscle. And then up here is a ligament called the hypoepiglottic ligament. It's a ligament from the hyoid bone to the epiglottis over here. The other side is identical. As I swing it around, it's great to see the outside structures and then rotate it and see those inside structures on this model right here. All right, this has been the video on this small larynx model. Comment any questions you guys might have, and thanks for watching.